and soft and well groomed. I'm going to go ahead and feel your scalp for any abnormalities. Tell me if you feel any tenderness. Everything feel okay? Mm-hmm. All right, we're going to go ahead and feel your sinuses as well. Tell me if you feel any tenderness. How's that feel?
It's all good.
All right, good. I'm going to place my hands here. I want you to open and close your mouth for me. Any pain?
Mm-mm.
All right, no clicking, so no TMJ. That's what we're looking for. All right, so I'm going to test your nostrils, patency of your nares. Go ahead and breathe in for me. Very good. Excellent. So we're going to look at your neck next. Okay. So I'm just going to look for obvious lesions, masses, abnormalities. Okay. I'm going to palpate your lymph nodes. So you've got your occipital, postauricular, preauricular, tonsillar, submandibular, submental, anterior cervical, and then both of your posterior cervical chains. And then I'm going to feel down on your collarbone. That is your supraclavicular nodes. And none of your nodes are palpable. That's good. That's a sign that you likely don't have an infection.
And please follow. That's excellent. I'm just going to quickly examine your neck, see if there's any lumps and bumps anywhere. Fine. And just over your clavicles. Right.
And we start in the posterior occipital region, and occasionally you feel lymph glands. Now this gentleman has a very hard lump in the back of his head, which is not a lymph node, and you have to distinguish bone from a lymph node. But up here he has about a 2 centimeter firm, bony protuberance. It is not a lymph node, and it's nothing of concern. As you come down, you just palpate with your fingers until you get to the posterior auricular area, and lymph nodes can be felt there. Usually they are abnormal, even when they're quite small in this location. And you use your fingers gently, and then you come down to the general neck area. There's another place that's important with the preauricular lymph nodes, and you feel with your fingers gently, symmetrically, and you don't usually feel preauricular lymph nodes. Even small ones would be of concern. May mean an infection, may mean something more generalized. As you come down then to the mandible, or the angle of the mandible, the parotid gland may be felt in this location. In this gentleman, we don't feel the parotid gland, but they will be symmetrical and may overlap that angle, and they are not lymph nodes. And then you come down along the sternocleidomastoid muscle, and you palpate for jugular lymph nodes. And you go up and down, gently if you can, all the way down to the clavicle. And these would be the jugular lymph nodes, cervical lymph nodes. And what's very important to distinguish is that there are submandibular salivary glands, which are symmetrical usually, maybe slightly different one side from the other. And this gentleman has a salivary gland right here, which is about 1.5 centimeters and small, and he has a smaller one on this side. But they are symmetrical, and they are not concerned, and they are not lymph nodes, in my judgment. The other thing you have to be aware of is that the carotid arteries are here. And very often, you will feel the carotid artery or carotid bulb and interpret that as a swollen lymph nodes. But lymph nodes do not pulsate. And when they pulsate, that means it's obviously a carotid artery. And they are in this location. Now this gentleman has a very small lymph gland on the right side, in the posterior cervical region. Right here, it's probably no more than 3 millimeters. It's flat. Lymph nodes that are normal are usually flat and ovoid. Lymph nodes that are more abnormal are spherical. And that you can sort of tell by your palpation. You come down, and the most important area to feel is the supraclavicular fossa. Now, sometimes it's a little better to just bend the neck forward to relax this area. And you take your fingers and you push right down over the clavicle and see if you can roll your fingers over any nodules. Now, these are most important because they are not usually found normally after infections. And if they are enlarged, they often indicate some process which is deeper in the body.
I'm just going to go ahead and tuck your hair back behind you, and I'm just going to palpate along the apical portions of the lungs and down the sternum, skipping over that area a little bit underneath up to the lateral portion of the chest. And because this is also a thorax exam, I would normally be inspecting and palpating your axilla and your breasts, but we're not going to do that today. I'm going to just palpate the other side of the chest now as well, noting any tenderness. No? No pain? I'm not too annoying? No. All right, good. All right.
Feel a couple areas on your shoulder here. Let me know if anything is tender. Any tenderness here?
No.
Any tenderness along here?
No.
Anything back here?
No.
And what about right in here?
No.
Okay. And what about in the front here?
Yes.
All right. And then right here?
Yes.
Okay. And then find a spot here. How about there?
No.
And then what about here?
No.
Or here?
No.
Any pain out here?
No.
What about in the front over here?
No.
And then what about in here?
Yes.
Okay. And then what about right under here?
No.
Okay. Can you turn your body to the right side? I'm going to be pushing along your spine. I'm going to have my hand on your head. Okay. Any tenderness along here?
No.
Or how about here?
No.
Okay. I'm going to have my hand on your head. I'm going to be pushing on your neck and back. I'm going to be moving you a couple different directions, okay? Any pain when I was doing any of those motions?
No.
Okay. So now I'm going to have my hand on your head. I'm going to position your head and neck, and I'm going to be pushing downwards. Let me know if there's any pain. Any pain there?
No.
Any pain there?
No.
Very good. Now I'm going to palpate your lymph nodes, starting with the occipital nodes, moving to the postauricular, preauricular, tonsillar, submandibular, submental, okay? And then the anterior cervical superficial and deep. On the other side, superficial and deep, and posterior cervical superficial and deep. Good. And then your supraclavicular nodes. Good. Everything appears healthy and normal.
Palpate all 6 levels of lymph nodes in the neck. Start at level 1, which is the submental and submandibular lymph nodes, and also feel for the submandibular gland. Next, feel the level 2 lymph nodes, which are the upper jugular nodes. Then the level 3 lymph nodes of the middle third of the jugular, moving on to the level 4 nodes of the lower jugular. Palpate the posterior triangle of the neck, which is level 5. Then palpate the central area of the neck, which is level 6.
The patient to relax his neck. Please, if you could look down a bit. So examining the submental, submandibular, the jugular digastric, the anterior cervical chain in front of the sternocleidomastoid. If you could please shrug your shoulders for me. the supraclavicular lymph nodes and relax the posterior cervical chain, the preauricular, the postauricular, and the suboccipital lymph nodes. So there is no lymphadenopathy in my patient.
Palpate the neck. All the lymph nodes, I'm going to start with the preauricular, which means before the ear, palpating. When I'm palpating for the lymph nodes, I'm using the pads of 3 fingers, 2 to 3 fingers, and then just using kind of a circular motion, preauricular, and then post or behind, postauricular, and then moving down to the tonsillar and submandibular, submental, right below her chin, and then anterior cervical. Posterior cervical is behind the sternocleidomastoid muscle. Deep cervical you can't feel until, unless you have Miley. Go ahead and turn your head one way. And the way she turns her head, you'll want to kind of press into the sternocleidomastoid muscle, and you can sometimes feel a deep cervical there. Go ahead and turn the other way. But a lot of times the deep cervical are deep, so you won't be able to feel them. The supraclavicular, supra means above, so above the clavicle, supraclavicular, and infraclavicular, or below the clavicle. Finally, the occipital, behind the neck. Okay.
Sensibel sowie die Kaumuskulatur motorisch. Durch Bestreichen der Gesichtshaut wird die Sensibilität im Bereich der 3 Hauptäste überprüft. Zur Überprüfung der Funktion der Kaumuskulatur wird der Patient gebeten, kräftig zuzubeißen. Anschließend erfolgt die Palpation des Musculus masseter und des Musculus temporalis.
So we're just going to check under your chin, so checking submental and submandibular along the jawline, checking parotid and tonsillar, then pre and post-auricular, and then checking at the back for the occipital, and then over your deep and superficial chains on the neck. We can't find anything untoward. That's good. And thankfully, there are no obvious issues at this point.
So I'm going to ask the patient to move towards my side, and I'm going to move back and forth using several fingers against the bone. I can try cervical using my thumb as a support in the front of the muscle, sternocleidomastoid muscle. I can also use my fingers as a claw and try the supraclavicular lymph nodes. And we can do the same in the other side. So remember to always move your fingers. With the thumb, we have some support for the cervical. And you can do supraclavicular. I'm going to review, move to this side. We're going to look into lymph nodes. Okay, I'm going to go to the other side. Have you been sick?
No.
Have you traveled outside the country?
No.
Or anyone in your family?
Chair, and I'm going to start right here at your jaw joint. I'm going to ask you to go ahead and open and close, open nice and wide, big as you can. There you go, and close. And I felt a little clunking when you opened that time. Okay. Where do you feel that?
Right side.
Right side? Do you feel any pain or discomfort?
A little bit on the left.
A little bit on the left. Do you know if you clench or grind your teeth at night?
Might clench a little.
Do you wake up with a tired jaw in the morning?
Sometimes.
Sometimes you do. Okay, let me check the muscles here. Squeeze your teeth together and release. This is your masseter muscle. Any pain here?
No.
Okay, let's try this one. Squeeze. This is your anterior temporalis. Just release. Any pain here?
On the left side.
On the left side, a bit of pain. Okay, and your posterior temporalis muscle, squeeze, release. How about here? Any pain?
No.
Okay, so the right anterior temporalis and the masseter and the jaw joint, we'll have doctor check that when he comes in. Now I'm going to start on the lymph nodes, and I'm going to start here around your ears. As you can see on that graph you're holding, there's lymph nodes in front of and behind your ears. I'm going to check the lymph nodes that come out underneath your cheekbones. Most people don't even know you have lymph nodes here. And I'm going to feel underneath the jaw for these lymph nodes as well. I'm going to come right down the front of your neck, feel your Adam's apple, thyroid. Do you have any family history of thyroid issues that you're aware of?
Not that I know of.
No? Okay. Swallow for me. Swallow on command is kind of hard to do, isn't it? And I'm going to feel the lymph nodes that go all the way around your collarbone. So I'm going to be just right inside your collarbone, between your neck and collarbone, and I'm going to press pretty firmly. I'm feeling for any abnormalities again from side to side, anything that's hard, lumpy, bumpy that doesn't belong there. Okay. Turn your head to the right and just let me support it here. I'm going to feel down the back of your neck. And lift your head up. This is your sternocleidomastoid muscle, and I'm going to feel right down this muscle also. Now, while I have your head turned to the side, I'm going to do a skin cancer check. I'm going to look behind the ear and along the hairline for any suspicious-looking lesions that don't belong there. Do you wear sunscreen?
Yes.
A good idea. You're very fair-complected, what with your reddish hair and your blue eyes. So it's a good idea to keep sunscreen on. Lift your head up again real quick. There you go. Rest back. Identify that sternocleidomastoid muscle. Okay. All right, and now just looking straight ahead and rest your head back into my hands. I'm going to feel the lymph nodes here at the base of the skull. These are the occipital lymph nodes. Okay. Good news, I didn't feel anything that was asymmetrical from side to side. No lumps or bumps that you need to be worried about. We'll be doing this exam for you once a year during your hygiene visits.
Okay.
All right, so you can look forward to that.
Thanks.
All right, you're welcome.
So when I start the exam, I'm just going to take a look at your head. Just going to examine that. You haven't noticed any bumps, any lumps, any drainage of any types, like from welts, nothing like that? No itching?
Nope.
Okay, great. And I'm just going to touch right here. Okay. I'm going to apply some pressure here, and I just want you to tell me if you have any tenderness.
Nope.
Okay. What about here?
Nope.
Great. I'm going to put a little bit of pressure here. I just want you to clench your jaw. Good. I'm going to touch you, and I just want you to tell me if it feels the same on both sides. The same? The same? So for the next part, I'm going to take a look at your neck, okay? Just going to take a look here. Okay. I'm going to apply some pressure on the left side. Apply some pressure on the right. I'm just going to palpate the lymph nodes that are in your neck, the submental, okay? Cervicoclavicle. Okay, and if you can actually turn around for me to the other side. What I'm going to do here is just palpate the posterior in your thyroid. You haven't noticed any swelling of your throat, have you? Okay.
We're going to palpate every lymph node, and your lymph nodes should be soft and untender if you feel the middle. They should be able to move under your fingers. Okay? You should not feel any firmness, any swelling, and the patient should have no pain when you're palpating this. Any of these symptoms could mean things like lymphedema, HIV, infection. Okay? So we're going to start with the preauricular, postauricular, occipital, which is back by the base of the skull, the parotid, which is over the parotid gland, the submandibular, which is under the mandible bone, and submental under the chin. Then we have the superficial cervical chain, the deep cervical chain, the posterior cervical chain, and supraclavicular, and the tonsillar. Okay. So all of these lymph nodes are named for where they're located on the body. So for example, preauricular is in front of the ear, postauricular in the back, occipital along your occipital bone, superficial cervical chain on the light part of the neck, deep. We're just going a little bit deeper for palpation. Posterior cervical chain along the back of the neck, supraclavicular, which is above the clavicle, submandibular under the mandible, and submental under the chin. And like I said before, your parotid, which is your parotid gland. Okay? So her lymph nodes feel fine. Do they cause any pain? No. So no tenderness noted. I don't have any swelling. They all feel movable. I don't feel many of them, which is a good sign. Go ahead and swing back around for me. The last thing I'm going to palpate is her thyroid gland. So someone's thyroid gland should not really be palpable. If you do feel it, it's going to feel like a little butterfly wing on your fingers. So I'm going to do it from a posterior approach. I'm going to have the patient tilt her head back, just slightly. I'm going to come from behind and gently place my fingers on her neck. Go ahead and swallow for me. Okay. And I don't feel anything. If you did feel something, you could have hyperthyroidism. It would usually feel like a giant donut. Okay? And you might even be able to see it on someone's neck if they had an inflamed or enlarged thyroid gland. She does not, and it feels perfectly fine. I could also do this from anterior. Thank you. So with the same approach. So she's going to, again, raise her chin just slightly. And I'm going to now watch for it. Go ahead and swallow. Good. Again, I see nothing on my fingers. I don't even feel anything. She's a perfect thyroid gland. I'm just going to feel your pulse. Good. Can you puff out your cheeks for me? Good. Alright, just going to feel your trachea. And can you shrug up against my shoulders and then down? And can you put your chin to your chest and then up towards the right side? Good. And towards the left and then back. Any pain with that?
No.
No discomfort? Alright. Your temperature feels good. Nice and dry.
So, we first feel for preauricular lymph nodes, post-auricular lymph nodes, occipital lymph nodes. I'm using the balls of my thumbs here to feel. Then we can do the internal jugular chain lymph nodes, first by feeling for that anterior edge of the sternocleidomastoid muscle, and then insinuating our fingers and palpating deep to the sternocleidomastoid muscle to feel for those nodes. We have the posterior triangle lymph nodes that are present between the anterior border of the trapezius muscle and the posterior border of the sternocleidomastoid muscle. Down here are the supraclavicular lymph nodes and then the infraclavicular lymph nodes. We can also palpate the thyroid gland in the midline. Again, we take our finger, roll it up till we feel the cricoid cartilage. Below the cricoid cartilage sits the thyroid isthmus, and we palpate. I can insinuate my finger then between the sternocleidomastoid muscle and the trachea and try to feel the right thyroid lobe and similarly the left thyroid lobe. If I did feel a mass in Brittany, I would give her a glass of water and have her drink, as the laryngotracheal apparatus will move superiorly and inferiorly as she swallows, and because the thyroid gland is attached to the laryngotracheal apparatus, and if that mass were originating from the thyroid gland, it should also move up and down.
Head for general size, shape, masses, and any tenderness. We palpate the scalp for mobility and for the texture of hair and distribution. We also can consider a couple of special exams that involve the temporal artery. The temporal arteries are located just anterior to the ear and are generally fairly easy to palpate the pulse. The anterior branch of the temporal artery passes toward the eye. Palpation along this distribution, you would note any tenderness, induration, or hardness, which can be associated with conditions like temporal arteritis or giant cell arteritis. Palpation of the neck over the trachea. This should be midline, it should be vertical, it should not be tender or pulling or tugging. To begin with the anterior auricular nodes in front of the ear, these are sometimes palpable in conditions such as conjunctivitis or other ocular disorders. Moving behind the ear and over the mastoid are the posterior auricular. And then Steve, I'm going to have you turn slightly towards me so that the camera can see as we go posteriorly to the base of the occiput for the occipital nodes. And these also follow down the neck posteriorly. Then as we come anteriorly onto the neck, we'll look for the posterior cervical nodes, which will be found in the posterior triangle. This is defined by the posterior border of the sternocleidomastoid, the anterior border of the trapezius, and the clavicle. So palpating within this region for the posterior cervical nodes. And I'll have you swing back towards the camera. And we'll do the same thing on your right side for the posterior cervical. Then we move anteriorly for the anterior cervical lymph nodes, which are found in the anterior triangle. So this is defined by the anterior border of the sternocleidomastoid, the midline of the trachea, and the angle of the mandible. So palpating within the anterior triangle for the anterior cervical lymph nodes. And it's generally fine to palpate these symmetrically at the same time. As we move up to the angle of the mandible, we will evaluate for the subtonsillar nodes, and then following the angle of the mandible for the submandibular nodes, and finally just within the angle of the chin for the submental nodes.
What I need to do now is I need to palpate your shoulder and the back of your neck. Is that okay? So we'll start off at the front here, and just let me know if at any stage you feel any pain or discomfort. Can I ask you just to turn that way a little bit? That's great, thank you. And just roll your hand out a little bit. That's great, and turn a little more for me. And just a little bit more around. And I'll just palpate your neck. Just tell me if you get any discomfort or pain at any point. Any concern there? No. Okay, and just turn around and face me again.
Good. Just going to check here. You can follow my finger. Go right. There you go. And try up and down. Good. Let me just take a look at your hands here. Good. Good. Okay, I'm going to start from back here. I'm going to check your preauricular nodes. And in front of your ear, I'm going to move to your postauricular nodes right behind your ear. And I'm going to sneak right behind your head to your occipital nodes. And I'm going to give you a little massage here in your scalp. Good. And I'm going to go down through your neck area. Just going to check your buccal muscle, your buccal meter here. Check your jaw. I'm going to check your submandibular nodes here. Your submental nodes. Good. Now you turn to your right just a bit. I'm going to go ahead and check your sternocleidomastoid muscle. Good. Now you turn to the left. Check your nodes along here. Good. Just going to go ahead and check your thyroid gland. On this side here as well. And come forward. I'm going to check your trachea and middle. Good. Can I have you swallow for me? Very good. You move to your clavicular nodes. Good. Okay. I have you open and close. Any pain or discomfort?
No.
No, sounds good.
Always palpate standing behind the patient and ensure you feel all contents of the anterior and posterior triangles of the neck. It is advisable to feel one side at a time. Start by feeling the midline structures of the anterior neck and then all the other lymph node areas of the neck. Including the submental, submandibular, anterior chain, supraclavicular, posterior chain, occipital, postauricular and preauricular lymph nodes.
Palpate the salivary glands and the lymph nodes of the neck from behind the patient. Submental, submandibular, preauricular, postauricular, occipital, posterior chain, anterior chain.
Carefully palpate the individual lymph node stations. To facilitate differentiation between lymph nodes and muscles, the area that is palpated should be as relaxed as possible. Every palpable lymph node is considered enlarged. If there is enlargement, pay attention to consistency, tenderness, mobility, the number of enlarged lymph nodes, and any erythema in the affected area. Multiple fused lymph nodes are referred to as conglomerates and are highly suspicious for malignancy. After palpating the head and neck, continue by examining the axillary lymph nodes, which can be divided into different groups as well. The pectoral or anterior group is located in the anterior axillary fold and is responsible for the majority of lymphatic drainage of the chest and chest wall. The subscapular or posterior lymph node group is palpable deep within the posterior axillary fold. It drains parts of the arms and the chest wall. The brachial or lateral lymph nodes drain the majority of the arms and can be palpated in the area of the proximal humerus. All of the lymph node groups just mentioned then drain into the central group, which is palpable at the base of the axilla. The subclavicular or apical group represents the last lymph node station before the lymphatic vessels drain into the venous system. This group should be examined together with the cervical or axillary lymph nodes. In this patient, the examiner starts by palpating the pectoral group behind the lateral aspect of the pectoralis major muscle. Afterwards, he palpates the central group, followed by the posterior group in the area of the posterior axillary fold and the brachial group of the upper arm. Distinguishing between lymph nodes and surrounding muscles is best achieved when the arm is relaxed and lowered. Afterwards, the superficial lymph nodes of the inguinal area should be palpated. They are divided into a horizontal and a vertical group. The horizontal group lies below the inguinal ligament and can therefore be palpated parallel to its course. This group is responsible for draining parts of the external genitalia, trunk, and lower back. The vertical group is located adjacent to the great proximal saphenous vein and drains lymphatic fluid from the lower extremity. Examination of the inguinal lymph nodes is best performed with the patient lying down.
We're going to check underneath the chin. Is that submental? Going along that submandibular. It's along the sides of your jaw. And checking the tonsillar. Moving up in front of your ears. That's the preauricular. And then the postauricular. Moving up the side to the occipital. And then we're going to check down along the front of your neck. And then to the back, making sure I can't feel any lumps and bumps there. If you could shrug your shoulders up and forwards, please. Okay. And then pressing either side of the clavicle, so there's no issues there. And relax for me. And just checking the posterior chain at the back of the neck there. So I can't feel anything there at all.
There's a area here in your frontal sinuses. Any tenderness?
No.
No?
No.
Okay, so no tenderness noted there. Then I'm going to be looking for your TMJ. So I'm going to be place my fingers right here and open and close. Any pain?
No.
So no pain with TMJ noted. Your pre and post auricular lymph nodes are right here. Any swelling? Tenderness? No. Okay, I don't feel any swelling. Okay, and then I'm going to be looking at your supraclavicular lymph nodes. Any tenderness here?
No.
No? No swelling. Your submandibular lymph nodes here. Any tenderness?
No.
No? Okay, and your submental tenderness? No. No swelling noted. And your cervical chain nodes right here. Tenderness?
No.
No? No tenderness noted. Okay. Let me see how it changed.
Okay.
No, still, I'm not sure if you can feel that slight stiffness there on the right. Yeah, I feel it here. What do you think? Yeah? Would it cause like a big headache if I release some of this?
No, I don't. I mean, we can try.
Okay, if it does, just let me know.
Okay.
I feel that.
Yeah.
Yeah, that's definitely there.
That concludes the examination of the skin. Next, I'm going to look at your head, first starting with your scalp. I'm just going to run my hands through your hair, checking your scalp for any lesions or any nodules. All right. I don't feel anything. Let me know if you have any pain. How about in your pinna? How about the tragus?
No.
And your mastoid process?
No.
Any pain? Very great. Any tenderness?
No. Feels fine.
How about there?
Nope.
Very good. So to start, I'm going to palpate in a circular motion, starting with the preauricular. Okay. Postauricular. And I'm looking for any enlarged nodes or tenderness or nodes that are not mobile. Occipital. And just let me know if there's any tenderness, okay?
Okay.
Tonsillar. Submandibular. Submental. And now for the anterior cervical. Superficial cervical. Moving down your sternocleidomastoid muscle, your deep cervical chain. Posterior cervical. Supraclavicular. Infraclavicular. And your epitrochlear. I'm just going to hold your arm like this. Just bend it for me, just like that. Very good. Now for this side. Just bend your arm for me. Very good. You have a few more lymph nodes, but I'll be checking those with other systems, okay?
Okay.
So moving on from your lymph nodes, next I'm going to examine your neck. All right? First, I'm just going to looking for any swelling. Okay, there is none. And next, I'm just going to inspect that your trachea, which is your windpipe, is midline, okay? And to do that, I'm just going to find your sternal notch right here, and I'm going to go on either side of it, palpating to see that it's midline. Very good. Okay, Emily, next I'm just looking for any swelling right under the cricoid cartilage, which would signify any swelling in your thyroid. I don't see any. I'm actually going to palpate as well. To do that, I'm just going to have you take some sips of water when I tell you to do so, and just hold them in your mouth, and when I tell you to swallow, please swallow, okay?
Mm-hmm.
This might be a little bit uncomfortable, but it shouldn't hurt.
Okay.
Okay. So this is your cricoid cartilage right here. I'm going to make sure that my hands are on either side, curved around your sternocleidomastoid muscle, between that and your trachea. Okay. Now take a sip of water and hold it. All right, now can you swallow for me? Very good. So when you swallow, I can feel your thyroid move up and down.
Could you sit forward for me, please? I just want to feel your neck from behind here.